All these cushions that we're going to talk about today, you can get through the Abilities Council. And there are 5 depots within the province, and one's in Saskatoon, one's in Regina, one in Prince Albert, one in Yorkton, and one in Swift Current. So all these that I'm going to discuss are available. There are many other cushions out there, but these are the ones that would be free to all the residents in long-term care. There are other third-party payers like SGI, Veterans Affairs, NIHB for those individuals that have treaty status. And so we're not going to go into that because there are, like I say, there's other available cushions out there. This is a T-foam, or sorry, this is just a foam cushion. It's just regular foam. You might have some of these in your long-term care facilities. Hopefully you don't have too many because they don't really have any pressure relief for the client. But I just wanted to show you, because if you do have these, we probably should get a person onto a different cushion if they're sitting in their wheelchair. We use these only if a person is in their wheelchair for going to a doctor's appointment, or they're going to the mall for a couple hours. So the wheelchair is not primarily their mode of transportation. They're still walking, using a walker, and they're just using it for longer distance. So this is just a regular foam cushion. Okay. So the 2 cushions that we look at as entry-level cushion, if a person has some risk of skin breakdown but they don't have any skin breakdown, is the T-foam, and there's a gel under here. So the T-foam, first of all, allows the person to sit on the cushion, and then it molds to the, if you can see that, molds to the person sitting on it. So they're well enveloped into the cushion, and so the pressure is distributed throughout the bum surface. So these are fairly high, so you probably wouldn't use this though if a person was still wheeling their chair. But these are a nice cushion. They look hard. The only thing about these cushions, don't take them outside in the cold, bring them back in, they'll be hard as rocks. So they really do form to the nice warm body that you're going to be sitting in the chair with. Okay, so this is an incontinent cover, so you don't have to wash these cushions as often, because washing this cushion would take probably 2 days to dry it, to get all the water out. So you can wash the cover if you need be. Now with this cushion, you are going to get some breakdown of this cushion over time, depending on how heavy the person is that's sitting on the cushion. So it's often good to just to look and see if there's no cracks. This one you can tell, I don't know if you can see that, but it's starting to crack. It's an older cushion, and so it may not have the good qualities in it anymore. So they can be reordered through the SAC anytime. Just leave this here for now. This, if you can see in that chair, if you just want to go back to the other slide, see how that cushion is sort of hammocking in that chair? So what we like to do when that happens, because all cushions have a tendency to do that, because the seat base on the wheelchairs are vinyl, and so over time they do stretch a little bit. So what we do in that case, you can go to the next slide, is we have what's called a rigidator or a sling eliminator. And this goes right in the chair. And you can see how in the picture that if you put it right under the cup of the cushion, it's now nice and flat. What I like to do is put this right inside the cushion so it doesn't get lost, because the more pieces you have, the more they go missing. So I just put this right inside the cover, and then we're good. So you can see how the flat part goes on top, and this goes on the bottom. Okay, so we just get rid of those now. It's like a cooking show. This is called a gel. I don't know if you can see that really well there. This has the same sort of feel to it as your fat pad on your bottom, so that when you are in this cushion, it helps to prevent sliding. But if you do a little bit of sliding, it actually goes with you, so you don't have that shearing that's going to happen with some of the other cushions. So this is really good if you're still wheeling your chair, you have some maybe skin issues, but not really at high risk. And so you can put this in the chair, the person can still wheel, get their feet on the floor and pedal, and it's really a nice cushion. It's very, very heavy. So it doesn't move in the chair at all. So like I say, it acts like a fat pad. So this is really a good cushion to have. Those two cushions, the gel cushion and the T-foam, you don't have to have a Braden scale done with it in order to get the cushions from the Abilities Council, so it's less paperwork. The other cushion is kind of what's called a combination cushion. This one is a J cushion, and what happens with this one is you have the gel over the entire, but you also have the foam on the bottom. So it's the gel and the foam together. So this one is really, really a nice cushion for those individuals that they're at higher risk of skin breakdown and or already have an ulcer. So it's important, and I think this is kind of the cushion that Donna was alluding to earlier. If this is put in the chair backwards, this can be a really, really big problem. I've seen stage 1 and stage 2 ulcers from just having a person sitting on this for the day, and the next day they've had an ulcer. So it's really important to put this in properly. And I'll just show you, there's a nice big well here for the gel, and so this acts in providing some relief to the ITs and the coccyx, and it prevents sliding out of the chair. So this is a really, really good chair or cushion if you have some sliding issues and you have some breakdown on your skin. This has a little bit of a pommel, and this is what causes the problem when you put this in the chair backwards. So I've seen people trying to slide out of the chair, and they're saying, I don't know why she's sliding today. She's sliding today. And the problem is that they're trying desperately to get off of this pommel, but they may not be able to tell you that there's some pain issues. So a lot of our dementia clients aren't able to tell you that there's something wrong with the cushion. And so they're trying to slide their bum forward to get off of that pommel. This happened with one of a client 3 times. I actually went up and changed the cushion around, and I finally started putting in incident reports because they weren't getting it. They just weren't getting it. They still were putting them in wrong. And part of the problem is if you put it in the cover wrong, then we always say zipper to the back. So people were putting it in after they washed it in backwards, and so people weren't actually looking at the orientation of the cushion. They were just looking at, oh, well, it's in right because the zipper's at the back. So it's really important to check. And with this, the more wrinkles there are in the cushion itself, the better the cushion is going to be. When you actually sit on this for a while, it kind of flattens out. So you need to knead it, just like this, before the person goes into that chair in the morning. So it only takes a couple of seconds to knead it. All these cushions this cushion is washable as well. And what we say with these cushions and then the Rojos we're going to talk about is these cushions should be washed once a week. So what we do usually, where I was working at Park Ridge, the day before people were going to have a bath, the night staff would take the cushions and wash them and then just hang them up, and they'll be dry by morning, and then put them back together. Because, of course, the bacteria on this is going to cause skin breakdown. So always, please, wash the cushions. These can be laundered. These ones actually can be put in the dryer. So when we put this back on together, we actually, there's a don't know if you can see that in there, but it actually says front on there. So I don't know if you can see that on there, but it does say front. So if you forget, but always zipper to the back, zipper to the back. And when you're putting this back together, it also has on it front right there. I don't know if you can see that, but it says front and then back. So it should be fairly foolproof, but you got to think about what you're doing. The gel always is for the bum area. And if you were even to look at this cushion, there's where your bum sits. So it's pretty self-explanatory. But people get busy and they rush and they just throw things back together, and that's a problem. Okay, so we're going to go to one of the other types of cushions now. These are the air cushions, and these are Rojos. So this is a low profile Rojo. Sorry. And this is a high profile Rojo. Now, one of the reasons why we use this low one is if a person is still propelling their chair, but they do have some skin breakdown, this is actually better than the gel cushion. And also you can be low in the chair then. So we would use this one. We would use this one if you're not pedaling and you can be a little bit higher in the chair. And for some people, they just like these better than the lower ones. Now, unfortunately, this Rojo, they still do have this at the Abilities Council, but they're getting away from them, so they're not ordering as many of these anymore. They're going to a different kind of Rojo, which I'll show you. The valve is we always put the valve to the front. This allows us to put air in there. The only time we don't put the valve to the front on these cushions is when the residents play with the valve, and so we need to turn, and sometimes they've actually pulled them off, so we put it around towards the back. These cushions can all be washed, and it doesn't take long to dry them. You do need to make sure you go in between, though, to dry when you are drying them. These cushions should never be lifted by their cells because you can rip them, or by the valve. Always lift it by the little yellow string that's on the front, or you can lift them on the sides here like that. So this is a really good pressure reduction cushion, and we're going to show you in a minute how we properly inflate them. This one is another Rojo that we use. It actually has two valves at the front, and so different parts of the cushion are used with the different valves. We have a lower section for the coccyx. Now, for those people that are having issues still with with their ulcers, we have this lower part at the back for if it's just a coccyx ulcer. So these are very, very nice cushions to have because it really offloads the entire coccyx area. So one valve here is to look at this and a little bit of the front, and the other one is to look at these two rows, and so you can kind of figure it out as you go along before you put the client in. Usually it's they usually are together here, but it's actually backwards. You'd think that the outside one would be for the outside and the inside would be for the inside, but it's actually opposite. So when we do fill these up, though, we look at the coccyx first, but then we also look at the ITs as well, because the ITs are going to be floating out here, and so we need to really look at proper inflation for both of these areas. Okay, so the last Rojo that we're going to be looking at is called the Quattro, and this Quattro has 4 quadrants in it, hence the name Quattro, and the air can be locked in at in all these 4 quadrants, and the way we lock it in is with this little device right here, and it does have arrows to show you which is locked and which is unlocked. So what we're doing right now is it's unlocked because we want the air to go all over the place. And so when we are measuring people to sit on this cushion, we have them have the valve open so that all the air is evenly distributed. The reason why they're going more to this cushion now, because a lot more people in tilt chairs, and when you're in a cushion like this, the more pressure you put in an area, the more it's going to push the air to the front. So if you're in a tilt chair, we usually use these Quattros or the J that I showed you with the gel at the back, and they're both good for stages of ulcers that are stage 3, stage 4 ulcers. So what we do here is we put the person in the chair and we actually check the air in it while they're seated in a flat surface, and then we lock it in, and then you can tilt the chair anywhere you want and the air will stay in all these 4 quadrants. Now sometimes when you have obliquities, this cushion is used as well so that we can support both sides evenly, and usually need 2 people to do that. So if we need to tip the person over to one side to have more air on the one side than the other, then we can do that and then lock it in. And these are really, really good cushions for uneven surface of the person's body themselves. So this is a nice cushion. It's used extensively now. These cushions are very, very expensive. So with all these Rojos and the gel, or the J cushions, they have to have a Braden scale filled out when you're ordering these cushions. This is the pump that we use to pump up the cushions. You just set it in on this little valve, open it, and then put the air in. It's best to put air in the cushion before the person is sitting on it, because it's just more difficult once they're sitting on it to put the air in there. So you overinflate the cushion to start with, have them sit on it, and then you can take some of the air out. This is one of the covers that we use for the Rojos. And so you can see on here, it shows you back, front, up, and down. I don't know if you can see that. So we always say, again, zipper to the back. With these cushions, except for this one, this always has to be at the front. And for this one, I mean, you have to have it in the right way. But this one, if you accidentally put this one in backwards or this other Rojo in back, you're not going to have any problems with the client. This one, though, if they're sitting on here at the coccyx and they have a coccyx ulcer, then you're going to have a problem. So this one really needs to be in the chair properly, and this one because of the valve thing at the front. So always zipper to the back. Now when you're, these can be laundered as well. So and like I say, it should be once a week for these cushions. So I think we're pretty good with those.
Whoops, I
Yeah,
should have done that.
That's okay.
Sorry.
You can see that cushion's upside down. You wouldn't think that someone would put a cushion upside down like that, but it does happen. So if a person did put this cushion in this cover, because the cover, you can see this is the back cover, it has a non-slip surface on it, and then this is stretchy. If you put that in wrong and you don't check it, then you're going to be sitting, and it happens all the time. And at Parkridge, one of the fellows said, "It just doesn't feel good anymore, Penny, my cushion." And so I just took a look at it. I said, "Oh my God, they had it upside down like this." So he was sitting on this part of it. And it doesn't take long for the skin to break down when you do that. So, okay, so that's sort of the cushions in a nutshell. Okay, so now we're going to go back and talk a little bit. Oops, I'll just take these off of here. Oops, that's yours. About surfaces for bed. So there are 2 types of bed surfaces that we look at, and one's a static and one's surfaces are things like overlays that we can actually put right on to the mattress, so that, you know, the regular mattresses in long-term care, they're not very soft, and so a lot of them have to be taken off, and what we use mostly at Parkridge are T-foam mattresses, and so that actually gives you some relief of skin breakdown. So we use those first, and then if that's not enough, then we look at overlays on those T-foam mattresses. And some of the overlays can be a sheepskin, and it has to be a green sheepskin, which is a medical grade sheepskin. And they are very good for stage 1, stage 2 ulcers. And the thing about the sheepskins is that you need to put the bear skin on the sheepskin. Now, they're also good for later stages, but the skin has to be directly on that sheepskin, and you can't really do that when you have lots of exudate and lots of leaking of the wound. It has to be covered. So, but if you have skin breakdown on your ankles, maybe some redness on your bum, sheepskins are really, really good. They actually whisk the moisture away, and they actually draw out the exudate. So that's one of the things that we use a lot. And there's also boots available. If you're sitting in a wheelchair, you can use the boots in the chair. One of the other overlays that we use are gels, but I don't know if anybody saw how heavy that gel is. You can get one for the entire bed, but it's very heavy. And clients don't usually like them very much because they're cool. And so they don't like feeling cold, and of course, and older people really like to be warm in bed. So it's not usually one that we use a lot of. We might use it just for the heel area, if one just a pad like that, and we'll just put it at the heels. The other thing that we use are Rojos sections, and they're very much like the Rojos that we have here, just these Rojos. And the only thing is they're 4 feet wide, and they are actually about 2 feet in length. So they're about twice this in terms of length. So what we do is we lay them on the bed, and in the area that you would have your skin breakdown, and then so the hip area and the foot area usually are the two. So we usually have 2 or 3, because sometimes you can't really tell where on the bed they're going to lie. You don't want to lie in between one of these, and we put little leveling pads in between them. So we really want to make sure that they're off of that area. So probably a leveling pad, 2 Rojos, and maybe another leveling pad, and a section for the feet. And these will be, we're going to show you how to properly inflate one of these Rojos. So it's the same on the bed as it would be in the chair. Now, the only thing is, when you're in the bed and you're turned on your side, you may need a little more air if you're on your side a lot, because of the fact that there's a lot of pressure on that one area in terms of the little bit of air that we have in the cushions. So you might want to put just a wee bit more air in the cushion on the bed. So those are the overlays that are available. Now, in the city, we're lucky because at Parkridge we have some long-term care Rojos, sheepskins that we can lend out to the facilities around, and for the outer regions of the health region, like places like Dalmany and Langham, and we can actually get a lot of these surfaces out to them, so if they need them. In the smaller areas, I would suggest that you purchase some of these things, because it's really, when you look at how much it costs for a pressure ulcer, these are well worth the cost. The other ones that we look at are the dynamic ones. So that would be anything that's plugged in. So the low air loss, and there's true air low air loss, and then there's low air loss. And there's also alternating pressure mattresses that are available. The Abilities Council does have a little small alternating pressure mattress. I would not use that. It is of no value, really. But you can leave that back up. So the true air loss, it actually whisks moisture away, and you also are submerged into the air mattress. So we use these because they're very expensive, and not very many facilities have them. And they're probably in range of $3,000 to $10,000, but even more than that, depending on the low air loss features. But they're actually, every facility should have at least one or two in their belongings. So what happens is the alternating pressure will act as taking pressure off certain areas of the body throughout the day and night. And it's really gradual, so the person doesn't realize that they're actually, the pressure is not on that spot anymore. So they're really nice surfaces, and like I say, every facility should have some. The one thing about the air mattresses, the dynamic ones, you need to look at, there's a little button at the end of the bed that says Fowler on it. And that button needs to be pressed and on anytime that you have the head of the bed coming up. Because what happens when you bring the head of the bed up, of course, all the pressure is on the bottom, and you're going to bottom out. So this Fowler button allows air to go underneath that area and bring the air surface back up. So anytime, it doesn't matter, it's 30 degrees, 40 degrees straight up, that Fowler needs to be pressed. Now on some of the more expensive air mattresses, the Fowler it automatically comes in. But those are really, really expensive, high-end, 10,000 or more pressure mattresses. So there's a lot of them available out there, and some of them are less money, and they provide some really, really good pressure relief for the clients, especially if you've got skin breakdown. That's usually when we use them, when we have some skin breakdown, usually stage 3 or stage 4. So that's just kind of a little overview of the air mattresses. So now we're going to do a demonstration on how to pump up a Rojo. So my Vanna is going to come up here. Let's move. I'll just bring this over here a little bit. Okay. Always make sure the brakes are on before a person sits down. Okay, so what we would first do, this doesn't fit her very well because her arms are a little bit high. This actually is an old chair and doesn't have adjustable armrests. So we would adjust that as well, first of all. The other thing we would do is make sure that her feet are on the pedals if she's not pedaling her own chair. Because what we want to do is make sure the angles are about 90 degrees. So the hip angle at 90 and the knee at 90 as well. And so then what we do is we take this off. Some come off easier than others. Whoops, oh, I think I lost my, sorry, technical difficulty. Put that back on there. Take my little sleeve that I have, and you may not have these, but you can just use a sliding sheet or something, because usually we have gloves on, of course, and it doesn't slide very well underneath. So what we do is, she's very cooperative. Most of our clients aren't able to do that. So we like to get it right underneath and go right to the coccyx. Not probably quite there yet. There, about there. We good? Sometimes the client can actually tell us. Now, I did only put a little bit of air in this cushion, and we're almost probably right. Good. as it is right now. Does that feel comfortable?
Yep.
So we do like to ask them if it's comfortable, because some like a little bit more air than the other. So when we put our hand underneath there, what we're trying to do is to see if there's about this much air between her bum and the bottom of the cushion. So we just use our finger to try and go up and down to see if there's that much in there. And it feels pretty good right now.
But if it didn't,
But if it didn't, I would let some air out, because I think there might be a little bit of a hole in this cushion, because I blew it up earlier. Put lots of air in it. Now there's not very much in. So what we would do is we would let some of the air out, and I don't know if you can see the valve again. We would just open that little valve, and let some of the air out until we thought it was a good range in there, and then we'd lock it in, close that, and then, sorry,
it's okay.
your legs. If you look here, this is that little button now, it's open, and so what we would do is we'd lock that in, so that air is not going to move around in there. It'll move within the 4 quadrants, but it won't go back to front or side to side. It'll just stay in there. So that's kind of what we would do for this cushion. There's lots of different backs that we can put on here. Right now she's sitting up nice and tall. She doesn't have any problems with balance, so we don't need any backrests that support here, but that's really important too. And if she did have an obliquity, or she was kind of scoliotic, and so she's leaning on one hip instead of the other, we would put, well, we would put more air on one side of the cushion than the other to try and keep her shoulders more upright. Because you can't eat when you're on a slant. You can't do a lot of activities when you're not sitting upright. So we look at the pelvis, and then we go up and see what's going on with the shoulders and trying to adjust the cushion appropriately. So that's kind of it in a nutshell on how to do that. Again, you're only looking at this much to this much air, ½ inch to 1 inch of air in that cushion. We don't want any more than that, because you're going to get skin breakdown. Now we had a client that refused to any other cushion except for the Rojo. The Quattro would have been much better for him, but he had it overinflated all the time. Now you can imagine he was on dialysis, and he had huge pressure ulcers, but we could not get him to change that cushion. We would not, because his mobility, he was a quad, and so he just felt a little bit uneasy in the chair when the air squished from side to side, so he wanted it fully inflated. So we really had a problem with that. But sometimes you have to sort of do what you can, and sometimes it's against what you would like to do. But that's it in a nutshell.